Surgery saves lives, but more medicine is not always better medicine. After 70, the goal should be to keep you strong, clear-minded, mobile, and living on your own terms.
Hello, I'm Dr. Davidson. I've spent the better part of 30 years working in emergency medicine and cardiac surgery. And today, we're going to have a conversation that, well, your own doctor probably hasn't had with you just yet. We're going to take a really frank look at some high-risk surgeries that if you're over 60, you have to think twice about. See, most people believe that if a surgeon recommends an operation, that's it. It's automatically the right thing to do. But after 3 decades on the front lines, I can tell you a hard truth. After 60, the math of medicine, it changes completely.
Look, this isn't just some theory for me. I have literally held beating hearts in my hands. And I'm telling you, the difference between a strong, resilient heart and one that's just tired and struggling, it's something you can actually feel. And that feeling, that direct experience is exactly why we need to have this conversation. It's about understanding that the goal isn't just to survive an operation, but to actually thrive afterward.
I want to tell you a quick story about a patient of mine. We'll call him Arthur. So Arthur was 78, sharp as a tack, full of life, walked 3 miles every single morning. He went in for what he thought was just a routine checkup and walked out with a referral. And then another one. Then came a so-called routine procedure. 6 months later, that same vibrant man could barely walk to his own mailbox. The original issue? It probably would have never harmed him. The test did. Arthur's story is just such a powerful reminder of what can happen when we're not asking the right questions.
What happened to Arthur? Well, it actually has a name. We call it the Cascade Effect. And honestly, it's one of the most underappreciated dangers in modern medicine. It all starts so innocently, right? A scan finds a little shadow, a doctor feels like they have to act on it, and you're scared not to. And before you even know it, this chain reaction has started, one that can, piece by piece, dismantle a perfectly good quality of life. As a surgeon, believe me, I've seen this play out more times than I can count.
So why? Why do the risks just explode like this? It's not about turning 60 or 65 on a specific day. It's about a fundamental biological shift. Let's really dig into why the rules of the game are just plain different after 60.
Let me give you an analogy. Think about it like this. If you take a brand new car, fresh off the lot, and another car with 200,000 miles on the odometer, and you put them both through the exact same grueling stress test, would you expect the same outcome? No way, of course not. That older car needs a totally different kind of care. For decades, medicine kind of treated a 70-year-old body like a 40-year-old one, and that's exactly where the trouble starts.
Okay, so there are 3 critical things happening inside your body as you get older. First, your mitochondria, those are the tiny power plants inside every single one of your cells, they start to wear out. It's a process called mitochondrial senescence. What it really means is you're literally running on about half power. Second, you get something called stem cell depletion. Your body's internal repair crew, the one that fixes everything, it's down to a skeleton staff. So when a surgeon makes an incision, you just don't have the resources to heal like you used to. And finally, there's postoperative cognitive dysfunction. This is that brain fog after anesthesia. And in an older brain, that fog can linger for weeks, sometimes months. It's a real trifecta of vulnerability that just changes the entire equation.
So, keeping that biological reality in mind, let's talk about 5 specific surgeries where these risks become, well, critically important. These are the procedures that really demand a second, maybe a third, or even a fourth thought. First on the list is what most people just call open heart surgery, or technically coronary artery bypass grafting, CABG, especially for patients who are already frail. Now, for a healthy 60-year-old, it can be a miracle procedure, but for a 78-year-old, stopping the heart, putting them on a bypass machine, it's a massive assault on every single organ in the body. The risk of a major complication, like a stroke or kidney failure, it just skyrockets to 30 or 40%. And for high-risk elderly patients, as many as 15% don't survive that first month. Those are just staggering numbers.
So here's your first empowered question. You need to ask your surgeon, is transcatheter aortic valve implantation, or TAVI, an option for me? This is a much, much less invasive procedure. It's catheter-based, so it doesn't require stopping the heart or cracking open the chest. It's just far, far kinder to a body that really needs kindness, not another battle.
All right, surgery number 2, aggressive spinal fusions. Look, back pain is almost a universal experience for seniors, but fusing vertebrae together with all that hardware, it comes with a complication rate of over 40% for folks over 65. And the biggest hidden danger is something called adjacent segment disease. That hardware creates such a rigid spot that the vertebrae just above and below it start to break down from all the new stress.
And here's the real key. We have multiple studies showing that for many seniors, this super aggressive surgery gives no better long-term pain relief than much safer options like physical therapy or targeted injections. A colleague of mine always says, sometimes the best operation is the one you don't do. He's absolutely right.
Number 3 is maybe the toughest decision of all, major cancer resections, like the Whipple procedure, which is for pancreatic cancer. Our first instinct is always, get it out, cut it out. But the Whipple is incredibly traumatic to the body. We see this heartbreaking phenomenon called failure to rescue, where the surgery itself is technically a success, hey, the tumor is gone, but the patient is simply too frail to survive the recovery. It's so important to remember that some cancers grow so slowly in older bodies that you are far more likely to die with them than from them.
Now for number 4, we have elective joint replacement. It can be life-changing, for sure. But the real danger for seniors often isn't the surgery itself, it's the stillness afterward. Lying in bed can lead to deadly blood clots and pneumonia. The solution? You have to ask about prehabilitation. It's a program of exercise and nutrition to get you in the best possible shape before you even set foot in the hospital. And finally, number 5, emergency abdominal surgery. Here, the mortality rate can just explode, up to 50%. The only way to win this one is to never have to play. Don't ignore persistent belly pain or bloating. Get it checked out early.
But the risk doesn't just live in the operating room. A lot of times it starts way earlier, with routine tests and even the medications you're already taking every day. Let's shine a light on some of these hidden dangers. This is where we really have to challenge some of the conventional wisdom we've heard for years about screening. After age 75, the prep for a colonoscopy can actually cause dangerous dehydration. PSA tests, they often find these slow-growing prostate cancers that would likely never have caused a single problem. And those whole-body scans, they're notorious for finding what we call incidentomas, basically harmless wrinkles on the inside that do nothing but trigger that dangerous cascade effect we talked about earlier.
Okay, this part is absolutely crucial, so please listen closely. So often it's not the surgery itself that fails a patient, it's the common medications they're on that have quietly sabotaged their body's ability to recover. Statins, they rob your heart of its essential fuel, CoQ10. Those heartburn pills, they block magnesium, which is your heart's rhythm guardian. Taking NSAIDs like ibuprofen every day puts massive stress on an aging heart. And certain bladder or allergy meds, they're linked to a shocking 54% higher risk of dementia. These pills are quietly draining your body's reserves.
All right, that's enough with the warnings. I don't want you to be afraid of medicine. I want you to be so healthy, you barely need it. So let's talk about what you can do. Let's talk about how to build up your body's own natural defense systems. I call it unloading the gun.
You might find this shocking. That 120/80 blood pressure target everyone talks about? Well, it was designed for 40-year-olds. As we age, our arteries naturally get a bit stiffer, and we actually need a slightly higher pressure to get enough blood to the brain. Over-medicating an 80-year-old down to 115 is a recipe for dizziness and falls. As you can see right here, the new, safer guidelines are age-adjusted. The goal isn't just to hit some random number, it's to keep you stable and on your feet.
Did you know that most heart attacks happen in the early morning hours? This simple 4-step routine can really help protect you. Hibiscus tea helps relax blood vessels. A few walnuts help the heart rest. A glass of water before bed prevents your blood from getting too thick overnight. And finishing your big meal early takes a huge digestive load off your heart while it's trying to rest. Simple, but powerful.
And get this, you can literally eat your way to a stronger defense system. C8 MCT oil can help preserve your precious stem cells. Kiwis have been shown to actually boost your body's own DNA repair capacity. Pomegranate is fantastic for feeding the good bacteria that act as guardians in your gut. And broccoli sprouts contain something called sulforaphane, which can help starve off tumors. This is what proactive health looks like.
Okay, this all leads us to one final critical point. The single most important factor in your health journey is you. You absolutely have to become the CEO of your own health.
So if surgery is on the table, I want you to walk into that room and own the conversation. You're going to ask 4 questions. Number 1, and it's the most powerful one. Doctor, what happens if I do nothing? Number 2, are there any less invasive alternatives? Number 3, what does recovery realistically look like for someone my age and with my health? And finally, number 4, you look them right in the eye and ask, what is your personal complication rate for this procedure in patients over 70? A confident surgeon, a good surgeon, will know their numbers.
Please, if you take anything away from this, remember this right here. After 70, the goal of medicine shouldn't just be to extend your life, but to preserve the quality of that life, to keep you strong, clear-minded, and living on your own terms. Every single medical decision has to be weighed against that simple human goal. You know, that heart has been beating for you every single second of every single day of your life. It deserves your best thinking, and it deserves your fiercest advocacy. I'm Dr. Davidson. Thank you for taking the time to become an empowered patient. Stay curious, and please, stay informed.
All right, house call wrapped up. Time to get back to the hospital.